Hi, everybody. It's Dr. Laura with Connect My Brain. So glad that you're here. Hope you're having a wonderful December. You might hear this in January, so whenever you do hear it, I hope everything is going just wonderful for you. So you are joining in on a case series presentation. I am going back through different cases that I've had in order to bring about an increased awareness of different things that go on in the development of a child that may relate to something you're seeing with your own child, or maybe it's for a friend. So this week, what I'm focused on is many parents are going to ask me, so how long is this going to take? And I wish I could really just look at the history, the assessment, the labs, and give you a very specific time frame, but sometimes that is just not possible. It's not only the things that you find, but it's also what's going on for the child, and either how many things are really needing support, how serious one issue may be over another, how long they've been going through this, how long or how far back can you go that you really knew in your gut something was going on. And unfortunately, many people, I don't think it's quite this way anymore, but especially way back in the beginning, and I've been doing this now for 27 years, way back in the beginning, most people automatically followed very traditional paths to address certain situations that we would put under some kind of umbrella, like developmental delay or skewed development or challenge development. It could even be a label like autism, Asperger, ADD, dyslexia, OCD. There's just so many. And typically people want to go down that traditional path because they're being guided. And lots of times because if they go down the traditional path that a medical provider has recommended, insurance is going to cover it. And one thing I would like to comment on insurance is try not to be limited by that. Now, look, I totally understand financial resources. I really do. However, we must realize that an insurance company making a decision about your health, they are not skilled, trained, they don't have clinical experience. They're looking at the bottom line, and the yeses and nos are coming based on what's it going to cost. So that's never a really great way to manage your health. And I know it is hard. Financially, it's hard, especially now. I really get it. But more and more, I bet many of you out there would agree, is that you are taking more out of pocket than you did in the past. And that's because many providers don't utilize a traditional model of insurance for payment in their office. And unfortunately, then you are expected to pay out of pocket. Now, any place that you go to, they should provide you with a super bill. And what that means is that it's going to cover a period of time. You're going to make a payment, and then you can actually send that statement to your insurance company. And sometimes it will go towards your out of pocket, and then maybe you'll go to a next level, a deductible, out of network. There are some possibilities, but I would really encourage you, when the opportunity does arise, to look at insurance, that you're looking for things that cover a wider variety of the direction or choices that you want to have. So it's not even left up to just is the provider going to take the insurance, because it's not just take the insurance or not. It's based on your policy. And lots of times policies are dictated maybe by a company, but they also give you an opportunity to look at the different things that you could choose. It definitely may bring up your premium a little bit, but it always would be better if you had the choice of looking at the different options available and making a choice. So with that said, I find that the financial piece, the insurance piece, and then, of course, how fast someone is responding are going to go into, are you going to settle into a program and allow the body to heal and get better? So with that regard, I've done many of cases throughout this time, and there's some that are incredibly just clear, and you can use all the standard approaches and people move along just as expected. And then it's about a 6 to 8 months process. But I don't even get the opportunity to really see how that child is going to respond until I get an opportunity to work with them. So one of the cases that really came to mind was a little girl. And at the time, she was almost 7. And we looked at her mechanics. We did some labs. And of course, we did some brain mapping. At that time, I was utilizing a system called Clinical Q and a stress response evaluation through thought technology. And I still utilize those pieces today. However, I also now have Brainmaster Technologies, which is caps and 19 channels and considered more of the gold standard. So when I was reviewing the history, some things that I always refer to as my red flags is why did she come? So there was some ADHD that had been labeled, hypotonia, so low tone, auditory and sensory processing, behavioral issues, impulse control, and some issues with speech and language. Okay, so that's quite a list, right? So that's 1, 2, 3, 4, 5, 6, 7. 1, 2, 3. Yes, 7 big areas. And this little person is only 7 years old. So that's a lot. But I still, for me, the way I look at this is there's a big transition between 7.5 and 8.5. So I look at it as a window of opportunity, especially to allow myself to look backwards, that you're literally closer to the beginning than you are to full maturation. In addition to the list, Mom didn't really enjoy being pregnant. She had headaches and cravings and frequent urination, things that we would say are very typical for pregnancy. But the delivery was quite interesting. So the history for this particular mom was her first baby was a very fast delivery. And she was alerting the hospital that had happened in her first pregnancy and that she wanted them to know that. So just in case this one would turn out really fast, they would be aware of it. And during the labor part, her water broke and everybody was very, very focused on the water part. But then she actually started pushing, and 10 minutes later, the baby was there. So even that's the transition from the womb to the world. And it's meant to take a little bit of time, especially for the first one. And then it's like your body goes through the practice of it. And the second one should be a little easier, but 10 minutes is almost like a rush, right? So what could possibly, from the innateness of our bodies, what could be the reason to push the baby out so quickly? So at birth, the baby was face up, had actually hit the mother's pubic bone, and she was blue. Well, that's a very big deal, because that's telling you that baby was not getting enough oxygen, and we really don't know how long that state was actually going on. And then there was the cord wrapped around the neck. So there's many thoughts about a cord being wrapped around a neck. It's all going to really depend on how tight that cord is. If you had a very loose fitting cord, there's a chance that it doesn't have any real impact. It's all going to be relative to each and every situation. But when I build this case, there's a chance that cord was even contributing to the lack of oxygen. And this is important because there's a very unique state going on at the time of labor and delivery. And our autonomic nervous system, specifically the sympathetic part of that system, which we call most of the time fight or flight, is acting very different. It has a very unique role at this time, and it will not act like this again. So what happens when we have a typical fight or flight, we just think of the whole system becoming very revved up, okay? But in this timing of life, it actually slows everything down so that the baby can go through the transition of being born. So one other indicator after the delivery is the APGAR score. And mom can only remember that it was only around a 7 or an 8. And apparently this was a concern for the couple, but I think it had also been dismissed. Unfortunately, in traditional care, and no offense, it's not my line of country, and they certainly have the right to do whatever it is that they want to do. But, in a hospital setting, this is a room. It is meant to be used for a period of time, and then it needs to be cleared out and allow for the next one. And that's why I think when we look at our hospital bills and we get charged $25 for a Q-tip, we need to understand that it is a business, and unfortunately things are going to be moved along. Well, over time, that is absolutely going to impact the view of everybody around there. And I'm sure also from clinical experience, they're trained to look at emergencies in real time. So I'm thinking in this history, the long-term impact by this type of a delivery and presentation. In a hospital setting, we're not thinking that because the baby's probably pinking up, the baby's now probably crying, everything appears to be okay. And it's not going to be treated as an emergency until an emergency arises. This is why I think it is so powerful if we could all work together. So if we had this understanding about the power of what happens in development and realize that each of these physiological events are so important, and the power of life is not in the hands of people that are there to assist you delivering your baby. It's not even in my hands. It's in the life that lives inside of these bodies and the spiritual connection that each of us have. And is somebody willing to put those pieces together and bridge a healthcare model that embraces all concepts and bring to the parent an awareness. Now, your child is stable, but that was a rough delivery. You may want to consider having somebody that specializes in development evaluate your child. This is one of the things that's very important to me because I truly believe and have met some wonderful people over the years that feel the same way. If we could get to these children with significant histories and begin to assess them early, could we potentially get them back on the right track faster so that at age 7, you don't have 7 things going on that now you're pretty much thought of as that you have some kind of behavioral problem. And this is the kind of thing I hear all the time. And everything is put into this behavior category when it is crystal clear that obviously something didn't get wired up the way it was supposed to. You come into this world formed, but you're not completely functioning. You have to go through the stereotypical development to wire this brain up. You go from the low to the middle to the high. And it is your experience that is going to determine how it all comes together. We all might have the same stuff, but it doesn't all come together exactly the same. And that's why looking at this model truly allows you to appreciate, okay, here's a few little obstacles that we had. And the most incredible part of these nervous systems and coordinated with their brain, which is part of the nervous system, but putting the whole thing together, it wants to work right. It wants to be efficient, but it also has a way of being inefficient when it didn't come together correctly. So I wish we'd had an opportunity way back then to have a chance to look at this little person. All right, let me move on. I'm trying to see real quick, did I have any other red flags that I wanted to share? Okay, let's go into what did we find in the assessment. So as I mentioned, back then, I was utilizing a technique or a testing assessment called stress response evaluation through thought technology. They also make neurofeedback equipment. And this system was my first neurofeedback system. But I particularly, and I still use this stress response evaluation today because it was a great way for me to add this to my practice to quantify an unintegrated Moro reflex. So Moro reflex comes on around 9 weeks of pregnancy. It should integrate around 4 months. It is going to bring about in the neurology 3 things: arousal, CO2O2 reflex, and the sympathetic nervous system. Briefly, arousal is that rhythmicity of the baby. Is that baby going to wake up and feed like it's supposed to? And then in the beginning, we are paying attention to the baby. We then start to teach the toddler how to pay attention to themselves, like in potty training. And then eventually we're going to mature up to where we can pay attention to others. So we already have ADHD in the reason why the child came here. So there's an arousal issue for this child, and it can be either over aroused for hyperactivity, or it can be under aroused, just like ADD on its own. CO2O2 reflex. This is your ability to get oxygen. Just had a very interesting case in the office where I've actually got a couple little cherubs in here that I don't think they're getting enough oxygen. And then over the last 3 years, but especially last year when these kids had to wear masks all the time, we were impacting their level of oxygen. And here's the interesting part. It's not always about the reflex not integrating, but you can put the body in such a state of stress that it's going to reach back down into that brainstem and pull up these reflexes again, because there's a significant threat going on. And this is the rudimentary place for all learning. And then the third thing that it activates is the sympathetic nervous system, your fight or flight. So this test, rather than only looking at does that child startle easily, I can quantify. I can see what's going on in the brain. I can see what's going on with the heart, with the temperature of the body, with muscle tone, with respiration. And I can see if there's a chronic stress pattern going on. The individual is exposed to 4 stressors, and we're literally recording the responses. And so in this particular situation, we get this one page that literally shows us in standard deviations what response that individual had globally. So in looking at this, the heart rate was 4 standard deviations away from what's expected. The temperature was 4 standard deviations away, and that's the highest it can grade. So I really don't know if it's beyond 4. The respiration was 1.5. Skin conduction, which is like sweat, like moisture to your skin, that one was in the green but below 0. And then the muscle tone on the left was 2.25 standard deviations away. And on the right, 4+ standard deviations away from what's expected. So I can tell you, even from one page, this is a person, a little person, that is absolutely in chronic stress. And then another test that I did back then was a clinical cue. And on her clinical cue, we're looking at 5 different regions of the brain, and we are collecting data. And in this data, it's going to come back and it's going to point to various things that could potentially be going on. And in this particular situation, the thing that really stands out is too much slow waves in the front. And if you got too much slow waves in the front of your brain, like sleep waves, you're going to have a very difficult time paying attention. The other thing that was very interesting to me was it also demonstrated PTSD. So I'm going to highlight that for you, because you're going to sit there and say, how does a child have PTSD? Anybody can have PTSD. The reason we've associated this with the military is because that's really how it got found out. So you're in the military. Let's say you're in combat. You're on the front line. There's bombs coming at you. There's guns being shot. You're in this for a period of time. You're on heightened alert all the time. Now you get out. You return home. You're walking down the street, and a car backfires, and you immediately hit the pavement because there's an association made in your brain to a sound that sounds familiar, and you're going to react. But the same thing can happen regardless of age and regardless of background. If you've gone through something long enough, and remember, I say this all the time, children do not have any point of reference to tell somebody, hey, I'm really having trouble making out this particular sound. And therefore, it's really making me anxious inside. And then I just cannot pay attention. We would be talking about a much higher brain function, a much more mature brain function. So this is what happens for parents is you start noticing certain things. You may even ask your child some questions, but again, you're like Charlie Brown's teacher. They really don't understand what you're asking. So sometimes they may just say no, or they may say yes, but it doesn't change the situation. And over time, the older your child gets, this is going to get increasingly more difficult for them. And the next thing you know, there's going to be a list of 7+ items that I'm struggling with because I didn't come together as expected. So when I look at this, not only do I have my findings from my stress response and my clinical cue, but what I'm also looking at is the movement. There was very poor coordination, poor balance, an inability to bring the upper and lower body into integration. So, for example, when you do a jumping jack, there is a timing. The hands go up, the feet go out. So when you look at this, it should be very smooth. They both should work together in the same timing sequence. But lots of times what you find is the arms move, but the child just sits there and jumps up and down. There isn't any real coordination of moving the legs and moving the arms. There was a lot of sensitivity to the skin. It was also reported that she didn't like tags. She didn't like the seams on her socks. So that automatically tells you there's a heightened sensitivity. When we did the rest of our exercises to determine if the body could move in that cross-crawl pattern, none of them could. So she's still stuck in what you call an asymmetrical tonic neck reflex, which is literally splitting the body down the middle. So briefly, because we go into these reflexes almost in every case history because you see them all the time. They're closer to the brainstem development model. So ATNR, or asymmetrical tonic neck, it is literally about helping to set up the lateral columns in the brain. So we're going to be split right down the middle. And the body at first is going to work almost like one side and then the other side. And this is still while these babies are motoring around on the ground. Then in order to crawl, that reflex has to get integrated in order for the body to learn the cross-crawl pattern. And that's when you start sharing the information from one side of your brain to the other, from one side of your body to the other. When you have this reflex stuck, there's absolutely going to be issues with anything, which is everything, about how the brain is going to coordinate itself. So, for example, the need to talk is on the right. It will rely on the work of talk on the left in order to have speech and language. The big picture idea is on the right. The detail is on the left. The ability for you to go from detail to big picture or big picture to detail, it's going to rely on the communication from one side to the other. Your big muscles are on the right. Your small muscles are on the left. We have hypotonia in this case. So if I just start looking at the reasons why she came in, it's under the umbrella of this one particular reflex, but then it's further compounded because The stress response evaluation tells me that you still have moro, which precedes ATNR, which you had a very significant birth history and your oxygen was deprived. That's part of moro. You came out too quickly. That's part of moro taking you through the transition. So the big picture idea in this particular case is, even from the very beginning, this child's development had been impacted. So wouldn't it have been great if somebody would have gone to that young mother and said, you know, we check certain things. Primitive reflexes are actually taught in medical school. They should be assessed at the time of birth, but there's so much hurriedness, it doesn't happen. But if it had, this mother could have been alerted from the very beginning. There are some signs that are saying we may want to look at her development, especially the first 6 months. But that didn't happen. So because baby looks okay on the outside, and for the most part, everything seems okay, we're just going to move forward. And the next thing you know, we're 7 years old and we've got 7 things going on. So how did this case go? Well, unfortunately, this is not one that I'll toot my horn about because I didn't get to see her long enough. She was only with us for about 5.5 months. And while I would like to say that every single case can be resolved in 6 to 8 months, that is just simply not true. It's going to depend on so many factors. For example, when I sit down with parents, I have to tell them, well, if you do exactly what I tell you to do, and we are always communicating, I know that we will get resolution. How long is it going to take? I can't tell you that. I can't tell you that until I have an opportunity to actually work with your child. And usually within the first month, I have a really good idea of how long things are going to take. And in this situation, we absolutely needed more time. We needed more parental involvement. I think they did their best when it comes to the food, but I also think that it meant that the food was going to be of long standing. And I think sometimes people come into the program and they think that we're just going to change the diet for while you're here. And unfortunately, that's not the plan. The plan is to show you how different foods are going to behave in our body and what we may have to do in order to change lifestyle. So the goal is not to go back to all the things that are known to be stressors, chemical stressors on the body. And then we have to be willing to feed the body not only the food, but the supplements. And unfortunately, sometimes you are on supplements for a while. And there are some supplements that are meant to be there forever. For example, if somebody has an MTHFR mutation, you have to support that pathway. That is a gene, and that's how we get toxins out of our body. It is literally connected to every single system of your body, and it's going to have to be supported. Now, there is some research out there that says that you can flip these switches. Unfortunately, I have not seen that yet, but people also have not gone back after a period of time of being on strict diet, strict supplements, addressing this pathway. They haven't gone back and retested. So if we don't retest, we don't know if that's possible. So there's some questions out there for the longevity. The methylation pathway is supported by primarily folate, and that should begin to ring a bell to you because that is the very supplement that they want every pregnant mother on. In fact, the way they found this mutation on MTHFR, it was related to women having miscarriages. And so it goes back at least to the reproductive system, but through research and time, it hits everything. It hits the cardiovascular system. It hits the brain. It influences that other gene called COMT on how you're going to make neurotransmitters for your brain. It's a very powerful test. It's a very easy test. It's a saliva test. We do not go through an internet service. This is a private lab company that we use. And this way we can find out if you have it. And about a year ago, we started with an incredible product called Enlight that has just made a world of difference. So we have very specific protocols in order to address exactly what we find through the lab testing. And that's what this is about. It's about looking at the uniqueness of this individual and supporting them. But I really want to speak to you regarding the longevity of supporting your child. You may have a child that moves through the program really quickly. We have a little one, almost 5 now. I keep saying she's my poster child because I've got to be honest with you. I have never seen such a little person who had such heightened emotional responses. I've never seen such a little person move quickly like she's doing. And I'm sure we're going to keep going through that because the parents are 150% committed. And they're even looking at things on their own or looking at their chemistry so that they can better understand how can they support not only their daughter in understanding certain things that are coming up, but how can they support themselves for the long haul of being parents of a small child. This is what it takes. And I know there's a lot going on, but we've got to look under every single rock and see what are the obstacles from keeping this individual from expressing optimal health. And I do believe it's possible. But the longer this stuff goes on, it's going to be harder to make those transitions. So if you're in a program and you're getting results, stick with it. It sometimes with some individuals, it may take longer. But that's okay because in the big picture, even if it took a year, you would have a child that's going to be able to resume life and be everything they're meant to be. It is so important to be part of the team. So I encourage all parents, stick with it. If you're not getting results, call me. Or reach out through the website. Send me an email. Let us know what's going on and let us see if we can help turn this boat around and get going in the right direction. Thanks so much for being with me today. You know, there's a lot of resources over on that website, and I certainly hope that you take advantage of them. Go underneath the podcast tab. There is Dr. Laura's developmental milestones, and I go through about the first 5 or 6 years. It's a free download, and that way you can check off your child's milestone acquisition. All the show notes are there. All the podcasts are there. Check out our eSchool. We have different tools for professionals as well as for families. And always, we want you to feel this is an open door policy. We not only take care of the child, we support the entire family. And hats off to my podcast manager, Marcy Page. I just love working with this woman. It has really enabled me to bring this information out to the community, and I couldn't be more grateful. Be blessed and have a great day.